Hello, ladies and gentlemen. My name is Dr. Kalitenko. I'm a medical doctor and I'm board certified in internal medicine. And today we're going to talk about detoxification. Basically, the most important thing is when we try to detoxify the patient, actually, it's not removing toxins. The most important thing is to stop exposure. Because if you don't, no matter what what the doctor does or the medicine does, it's not going to work. I remember a patient who came to me with, um, we found that he had heavy metal, the mercury burden high, and I explained him that he needs to be detoxified, and he said, okay, and they said, but you have plenty of silver fillings in your mouth, so you need to remove it first. And this kind of hard to understand for patients. If they don't remove the source of the toxin, there is no way we can detoxify you. So how do we diagnose first if a patient needs detoxification or not? In case of heavy metals, we do not rely on the level of the toxin in the blood. Why is that? Because our body does not keep heavy metals in the blood. The heavy metals are sitting in brain, in bones, liver, kidney, etc., but not in blood. What we see in the blood is the spillover. And obviously it can be nothing in the blood while somebody's system can be filled out with toxins. So what we do, we use so-called provocation test. We check the level of heavy metals before provocation, then we give a patient a provoking agent, which what does is takes the toxin out of the system and brings it into the blood. And then we check the level again. And by knowing height and weight of the patient and knowing the difference, we calculate the burden. That's pretty much what we are looking for. Levels in the blood is not really informative because they could be high because my levels could be high because I maybe ate sushi yesterday and that's why today my levels are high. But in fact, it's my system doesn't have any mercury, so it's not informative. Informative only a provocation test because it really shows us what's going on in our body, in our tissues, not in the blood. That's the most important thing. And as soon as we find that somebody has increased heavy metal burden, then we have an option to detoxify this patient. So in case of heavy metals, what we do, we use a combination of treatments. Okay, first of all, this patient needs to get vitamin C. Why is it important? Because vitamin C is is very important to actually to break down the bond between a heavy metal and the tissue. That's what it does. And as soon as heavy metal is free, then it's picked up by a chelating agent and delivered into the organs that are eliminating it, the kidneys, digestive system, and that's how it's taken out of the body. And of course, who has constipation probably the constipation should be treated because constipation is one of the most important things why toxins start piling up. It's not only for heavy metals, for hormones, for estrogen. Why do we have sometimes estrogen dominance? Because of a very simple thing, because estrogen is not eliminated through the digestive system and starts piling up in our body. That's why. That's why fixing digestive system, how it works, is very important. So how do we detoxify patients with who has increased heavy metal burdens? We use three ways. First, spills, if the level of heavy metal burden is low. If pills don't work, we use suppositoria, and obviously the IV is the most effective and fast treatment for heavy metal toxicity. It depends on what kind of toxicity, what is the offending agent, and how fast we should solve this problem. The time factor is also very important because somebody has who doesn't have some kind of emergency conditions, they have time and they can be detoxified at a kind of slow rate. But who has a condition that requires immediate attention, like who has cancer, obviously, that we need to detoxify this person right away. So we are going to be most aggressive. And of course, before detoxifying, we are checking how safe it is. There is no treatment in the world that is 100% safe. That's why we need to monitor electrolytes to make sure that we're on the safe side. We detoxify slowly. We replenish minerals if we need to, and monitor levels on the regular basis. And that's pretty much it. But the good news is that heavy metal toxicity is not something we cannot treat. Yes, we can. And it's relatively easy to do as soon as we diagnose that the person has heavy metal issue. As soon as diagnosis is made, then the treatment is readily available. Thank you.